Hi guys, welcome in. This is I've been live for a couple of times, but I want to welcome you guys into the live. Um, if you're not here for the original live and you're catching me on streaming or later, if you have any questions or comments, please leave them in the comment section, and I'll definitely get back to you. Um, I just want to thank everyone for joining, and let me just put a welcome note in. And so many of you guys know that Dr. Duncan has been on the show before. He is back again. He received several questions and people reaching out to him. So he wanted to get back with you guys and do another live. I want to make sure that everyone can hear me. If you can hear me, if you just drop that in the chat, that would be awesome. And I'm going to add him in now. All right, Dr. Duncan, we have you on. Are you able to hear me?
Yes, loud and clear.
Okay, awesome. So I was just welcoming everyone and explaining that you were here before and that you're here again, and you've received several questions probably, or people reaching out to you. And so we're just touching bases back again. And I will let you have the floor.
Thank you. Thank you. Phil.
You're welcome.
Always great to be back. It was incredible. The response
Yeah.
the first time, it was amazing.
Yes.
My assistant,
Awesome.
the nurse is like, Doctor, what did you do? And people are calling like, what show? Where were you? Because they didn't know that I was going to be with you. And people reached
Okay.
out. Thank you. That this window that you are offering, this window of
Yeah.
information is so
Yes.
necessary in a time when people had so many questions about
Right.
specific decisions in their life. Decisions like, do I move? What do I do? What options do I have? And in a place where you want options, it, it's
Right.
not like moving or where you're going to move is what options do I have? Or having options is always a good alternative, a good choice. So in that
Right.
regard, one of the most important things I always say when you're moving to a new place, yes, um, where you're going to live is important. What options, food, the place, quality of life, all of that is important. One of the most
Yes.
important things is healthcare,
Yes.
and not only when you're moving, like in general. So,
Yeah.
especially if you are of a certain age, carrying certain illnesses, chronic illnesses that you need certain medications. You want to make sure that wherever you are, you have doctors that understand what you are going through, that there are the medications necessary for that situation, and that language is not a barrier. That your health is not going to be an issue because there is nothing that would affect your quality of life like your health.
Right.
So knowing about your health and where you're going, what you're doing, that is crucial. And understanding what options there are in Panama. We have different options of healthcare. Number
Right.
one, and the most popular for Panamanians is the Social Security. That is something that you work. If you are Panamanian, you have the privilege. You pay as long as you're working. You pay your quote your fees, and then you receive benefits as
Right.
Social Security everywhere else. And then you have
Right.
the public and the private sector. Then
Yes.
differences between each everyone. Social Security is as long as you're working, you're entitled to it. The government takes a piece, and you are good to go. You receive the benefits. Um,
Yes.
One question I receive regarding that is that if foreigners could pay quota and receive the benefits. And at first, I remember I reached out to you and said like, no, I'm pretty sure that it's a benefit for Panamanians and citizens, but under further review, it's an option.
Mm-hmm.
It's an option
It's
available. Like if yes, like if you are not, if, for some reason, people have the assumption of if you're coming from outside, you're loaded. You can pay everything
right.
out of pocket. There's no problem. You can, but reality is not like that.
Right. That's
And
true.
having options is key. And on that regard, when I
Yes.
was reading, yes, as long as you are a resident, you get your permanent visa, you do the due process, your due diligence, and you can
Mhm.
demonstrate that you have like an income of like at least 500 a month. You
Okay.
can pay a quota and you're entitled to use the Social Security. So that is an option that thanks to you guys
Really?
and your questions, I didn't know.
Thank you.
I
I
had
was
the
wondering
idea.
if you could. I was wondering if you could receive healthcare under the public system if you're a resident.
Yeah.
Now, that would be different for like, of course, if what if they have like temporary residency? Is that the same, or do you have to have permanent, you think?
Yeah, we are permanent will be the
Permanent.
e-scheduler. So it's a matter
Okay.
of months. Like, like you
Right.
receive your temporary. It's a couple of months until you receive your permanent. Once you receive your e-scheduler, you're good to go. And that I didn't know. And that is an option.
Oh, that is great to know because I was like wondering, I met a lady
Mm.
who she had a medical emergency. She was in Bocas del Toro and she
Uh-huh.
had a medical emergency and she had to be rushed to a public hospital. She speaks Spanish, so
Mhm.
I guess she's a resident and they rushed her to the public hospital and she had to have abdominal surgery and everything, but she did it in a public hospital and it was very inexpensive for her. So I was just
Yeah.
wondering, is that an option for us who, if we have the residency so we can go to a public facility?
Yes. And again, thanks to your questions and your inquiry, that is a possibility that I didn't know. And now I know and I can share with my patients and other
That
people.
is that is so awesome. Hi, B. Willen. I'm not saying your name right, but I just wanted to say hi, give you a holler. I see you on with us. Of course, Ralph Cordy is on with us. Hopefully, he's still on with us. Um, so that was a question that we received. I know that based on this live, there has been a lot of feedback about your clinic, what kind of services you offer, what like say for instance, if someone is visiting and they don't have a residency, but they just visiting, if something happens, are you available to see those? And how does that work? Have you had that happen to you before? Like if a expat maybe comes to visit and was here like 3 months or something like that, or 2 months, and they may have an injury or twist their ankle or something like that. Have you seen cases like that?
Absolutely. There is,
Hmm.
I would say that 50, let's say like 35 to 45% of the doctor visits that I receive, it is from non-residents. I have people that are
Mm-hmm.
calling that like, we are looking into Panama, but we just want to make an appointment to check on my health. And they just come. There are people that come to Panama just to get attention at Smart Clinic and Lab. That's something that
Yes.
happens. The people that have been here that has had some issues in tours and have received service at Smart Clinic and Lab. People that just came in. I had this guy that he was sailing across the world. Like, go figure. That life that I would like to have someday. So he was in Panama and he Googled a clinic. He needed refill of medication and had like a thing, something he had. So he
Mm-hmm.
Googled, found the clinic, came in, and he got attended. So
See?
that you do not need to be a resident, like anyone at any moment
Yes.
can receive services at Smart Clinic and Lab. And that's like part of what was talking about the different type of clinics and services that are offered in Panama. Like the
Hmm.
public is the Social Security, and then you have
Yes.
the public that is open to everyone, and the private.
Okay.
The public that is open to everyone, like the famous Santo Tomas or San Miguel Arcangel. There are different hospitals and clinics that you can come in. Don't have to be a resident, don't have to be nothing. You pay a little bit out of pocket, no problem.
Yes.
As
Yes.
the private institutions as well. This is the thing here in Panama. I've mentioned it before. The same doctor that would work under the Social Security institution would work on a public institution, would work on the private clinic. It is not like the best doctors work at the private and the other ones like everyone works everywhere. So you receive
Yes.
the same like professional is
Level of care. Hmm.
that is not the differentiate factor between
Hmm.
systems. It's not the level of professionalism. I think it's the level of care based on the saturation. Social
Okay.
Security is very saturated, public
Yes.
also, and then private is
Yes.
less saturated. So the quality of attention is
Yes.
way better when there is less saturation. On the
Yes.
Social Security system and the public, it is something like on the US that you have 10 to 15 minutes with your doctor. Good luck, go.
Yes.
And that's it. Whatever you can get in that time, you go because especially on the Social Security, we are like this, clockwork. Come next, because there's so much people, and then we have like a script, da 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 da, this. Public
Yes.
is a little bit less, but practically more of the same because there's so many people that the doctor cannot spend the time with their
You
patient.
have a so you
And
have a certain amount that you need to see per day, or each slot that you have to see a patient every so often. I know that's how it was in the States. When I used
yeah,
to work with doctors in the clinics, they would have like 30 minutes for one appointment. And this is a veteran. I was working with the veteran clinic. And if anyone knows or is a veteran, it takes them longer because they have a bunch of other things that's going on that aggravates their conditions, right? So they
yeah,
need more time to explain. And so we were rushing, like rushing them through.
yes,
So yeah, I get it for sure.
yeah, doing the best you can with
Mhm,
the time that you have.
mhm.
Yes, sir.
I was going to say hello to Aqua Sands 1988. Thank you for joining. She wanted to thank you and me for doing the live. If you guys like in the chat, just drop where you're chatting from or where you're from. And of course, if you have any questions, please drop them in the chat. We would be glad, or Dr. Duncan would be glad. If I can help you, I'll be glad to help you answer any
Absolutely.
question. Yeah.
Yeah, absolutely. I was
So
shout out. Yes.
So we just wanted to come back on because we had such a good reception from the last live. So we're just dropping open, we are open to any questions that you have. Um, Mr. Cordy has a question for people with kids either visiting or living in Panama City. Are there a children's hospital or clinics available for children around in Panama City, or where would you suggest they go for children?
Oh, absolutely. We have the Big Children Hospital, which is a private, I'm sorry, but it's a public institution. And then we have a Children's Specialty Hospital, which is a social security institution as well. And the private clinic has pediatrician and general practitioners. We see children as well. That's another differentiated factor. Normally, you'll have in the States, you have your pediatrician that will see every and any concern of your kid until he is of a certain age. Here,
Mhm,
we have the pediatrician that sees specific things, and once a year, once every two, twice a year. But then
mhm.
for normal stuff, general practitioners, we attend children as well. But yes, we have that option on the public and on the private as well. And
Okay.
yes, preferring yes the cons and pros of those systems. The The pro of a system, of a traditional 50 minutes in and out system would be if you have an emergency or if you have something specific, they call you don't like it's okay because you don't have to well, you have to wait until the patients are in front of you get attended, but you won't have to wait a lot between patients. If you have something
Okay.
specific that you don't want to, you don't have to, again, I just have a cold, I just have a cut or whatever. You go in, go out. And that's one of the advantages. And that's good.
Right.
The con is that if you have an issue or if you're interested in your health, then that's not the system that's
For
that
you.
you want to go into. That is just not the system for you.
Mhm.
On the private, on the private, then you have the bifurcation of the traditional medicine, which we all know, and road to experience, which is you come in, what do you have? Take this, get out. And the preventive medicine, which is and I say it time and time again, it's not the best or not one of the best stuff. It's the only type of real healthcare
Mhm.
where
Mhm.
you can spend time with the patient and just dig into the situation and figure out what is
Mhm.
the cause of the symptoms instead of treating the symptoms.
Dr. Duncan, are you able to see? I'm sorry to interrupt. Are you able to see the chat there?
No, because it's very small and I have
Oh, you can't read. Okay. All right.
so if you can help me
I
with
just
that,
wanted to, I will
that would
read them
be
to you.
yeah.
There, okay, we missed, it wasn't a question, but a lot of people are saying hello to you. Let me see. Cynthia Townsend says, hello, Dr. Duncan. Aqua Sands,
Yeah.
1980. She's from California, USA, where healthcare is unaffordable. And Aqua Sands, you are like, that is, I think that's everywhere because it was like in Georgia too. So I understand. Ace's mom says, hello, or hola, everyone. What's up, Dr. D? She has so many questions. She will drop them in the chat. And
Okay.
then Cheryl Austin, hi there. I live in David and let me see what she said. I live in David. I have Medicare. Is there an affordable health insurance for expats that are over 60, way over 60? Do you know of any?
Way over 60. They are, well, to define affordable.
Right,
Yeah,
define affordable, and I think the insurance changes it changes over is it over 65 or is it
actually,
over 60?
depending on your age bracket, I think it's like every 10 years, like 45, 55, 55, 65, 65, 25 until 75, then uh, is different. It increases according,
Right.
depending on your age and your health condition, your pre-existing conditions, and so on and so forth. Um, be
So
good.
Cheryl, I'm sorry, Dr. Duncan, go ahead. I was
I
gonna
was
say,
saying I would
she's
just
69, she's
okay.
69.
Okay, we could investigate if we could, yeah, investigate and then have some
Mhm.
options. Or if we can
Yep.
bring, because I know a couple health insurance brokers or people that manage that. It would be great to have them and see what options do we have
I think we
available.
did. I don't know if I think the hospital does have insurance, but I think your age is affected by that as well.
But
So
thing that
we'll
she is in the VID.
she's
So
right,
I
that
know that
what's the
there are hospitals here in Panama, like Santa Fe. Minimed is
mhm,
another one that has their own private plans. San Fernando is another one. But then in the V, I'll have to check to see if in that vicinity area, the Jose Maria Valdia, and there are other Panamerican, I
mhm,
think they have a couple hospitals
they
to
do.
see if
They
they
do.
carry their insurance or what options are available in that area.
Cheryl, that is a great question. And I'm going to write that one down and we're going to do some research for you and see what we can find out. I know age is a big factor on a lot of things, but there are some clinics and whatnot that's over
Mhm.
here in David that provides pretty good care. I've met a couple this weekend who had a situation. They went to a clinic, a public clinic, and they were able to receive care. So let me just do a little research on that and maybe I can we get back to you on that one. You just if you send me like a little text, little message, say, hey, this is Cheryl, such and such, and we'll definitely look into that for you. Ace's mom, do you think you would ever have an interest in working with TRICARE or VA FMP insurance?
Absolutely, absolutely. And since I opened the practice, be sending emails, stuff like that. It's a process. I understand it's a big process, but you know what would help if everyone listening who has TRICARE or FMP or veterans or whatnot could write to insurance and say like, what do Smart Clinic has to do to be able to insure their patients or to attend us that has this? If you can contact Dr. Duncan, they have my information, or whatever we need to send, we'll do. So whoever has TRICARE, EMP, and all that, just write your provider and ask them, what do a clinic like our clinic, and you can give my specific information because they know they have heard from you. Maybe that will
I think
send the will.
I think Ace's mom is probably already working on that for you.
Already typing.
FYI, yes.
Already typing.
Um,
Yeah.
yeah. So she's probably already working because she does know some doctors in the area, so she will be probably working
Yeah.
on
So
that.
whatever the
Yeah.
requirement.
So be willing is Dr. Duncan based in Boquete. I think Ace's mom answered that for you. I love to hear from Dr. Duncan. He needs to come to Boquete. We've been talking about you coming to Boquete.
Yeah.
Me and Aqua Sands, you need to get on board with me and Ace's mom. We've been working on it. And we're actually trying to actually do something for him to get him here. So
And
yeah.
and you guys are moving the needle over there. I'm checking things as well because I said it the last time that we were on site. Boquete was always a destination of mine for Smart Clinic. Not because of definitely because of the huge amount of expats that there are there, but because of the nature based, like the city, I love the city and all that it entwines, but like nature, like air
Yes.
quality, just quality of living, that you can do so much health in an environment like that. So
Yes.
having something there, second base of operation, that's always been on my plans. So continue praying.
We are working on that.
Absolutely,
Yes.
absolutely.
Cheryl, thank you both. It's like it's there. She said it's like having a penalty for living longer with the insurance. The longer you live, the more they take from you. You can't drive. They just she's
Yes,
right.
exactly.
Yeah. Hi, Miss Parker, 770G. What Panamanian is this her question? What Panamanian insurance do you accept and what hospital are you affiliated with?
Well, the first part, again, insurance companies, private insurance companies are not very fond of preventive medicine. That's just not one of them things. So once I was opening Smart Clinic and Lab, I reached out to Blue Cross, Blue Shield, Mafre, Palig, I think another one, just to show them like what we're doing. This is what I'm doing. And they was like, oh, preventive. Well, yeah, right now we're not accepting new clinics, which is weird to say the least, because that's their business. They take
Right.
new clinics. So I know it was because of the preventive part, but not because of that. I won't stop doing preventive. But strangely, now there have been a couple insurances that have been circling, asking to start conversations. So at the moment, we're not working with private insurances. We have our concierge plans for Smart Clinic. But yes, we've been talking to two different insurance companies and that we are trying to get on board because they're seeing the benefit of preventive medicine. Like really,
So
if we
that's
want
like
to
a
do,
way that's like a
yeah,
way that Panama is going towards preventative medicine, but it's not where you at right
yeah.
now.
Actually, the world
Okay.
is shifting. I'll say after COVID, things just shift and rapidly between after the last couple of years, but that's a possibility. And I want to be one of the champions of that, incorporating preventive medicine into healthcare. Because not because
Yes.
you want to be healthy, like a listener said, you have to be penalized. Hey, I want to stay
Yes.
healthy, so I have to be penalized because I want to be outside the
Be
system and
stay
take
healthy.
care of myself.
Right.
Yeah. So
Right.
we're working towards that.
So
And
do you have affiliation with any hospital, or do you see patients at in any hospital, or?
oh yes, and the second part of the questions, one of the advantages here in Panama, different from the states that you have to be affiliated to a certain hospital to see your patient there. If you are a board certified doctor, you can go into any hospital or institution in the country and just say like, oh, you have my patients, I'm their doctor, and then you can go in, talk to the patients, and you could just discuss treatment. You're not the primary care doctor. That would be the doctor assigned by the hospital, but you can work with the doctor regarding your patient's treatment. You can share information, you can go visit and determine and help determine the course of the outcome of the patient. So at any institution.
And I hope you guys are able to read the chat. If not, I'll just read what's here. B. Wallen mentioned to Cheryl Austin, if you did any of the relocation tours there, they have an online guides and books that all information for getting public and private health insurance is available. Ace's mom mentioned that if you're 70, it's harder here, but at 69, you're right under that bracket, according
Yeah.
to Dr. Dra.
Yeah.
So she's Dr. Dra Shannon. She is the doc, one of the docs out here in Boquete, and she sees a very large amount of veterans. So she falls under that veteran care doc. She's certified to see veterans, but she also sees regular patients. So that's her answer. Cheryl said hospital Cherokee is great. Cherokee is
Yeah.
great, affordable, but she's thinking of something beyond self-insuring.
Mhm.
So yeah.
Yeah, it's
And
always
Dr.
good.
Dunn, yeah,
Yeah, it's always good to have options. Is even though it's very affordable and you can pay out of pocket. If, for example, I'm just throwing numbers here. If you are hospitalized and say like have appendicitis and you need to have a surgery, and in the state it would be like 100K.
right.
Even though
Easy.
here, even though here could be what? Oh, you have to spend a couple nights. So at the end of the day, it's like a 5 or a 10K. Even though the difference is huge, if you have 5 or 10K, I would rather spend it on a nice retreat or invest or do
Right.
something. So if I have the option of a good insurance, I'll have to pay and that would be covered. That'll be great. Having emergencies covered, that is the key.
That
And
is
that's
yes.
that we should be
Yes.
working on. And we'll be looking for answers on that regard. But as
Yes.
that question can continue flowing, I'm just gonna continue just talking about the differences, the pros and cons of the different services. And like I said, the public, that is the good thing. If you need something fast. In the private, on the traditional system, the advantage is if you have an issue that needs to be resolved, you have the time to spend with a doctor to resolve it. You'll be good. Paying out of pocket here in Panama is completely doable, completely uh, compared to the States is day and
Yes.
night on regard of what you'd be paying. But then you have the preventive medicine, which the advantage is that you'll be one step ahead of your sicknesses. And that's what we do at Smart Clinic and Lab. We don't
Mhm.
wait to see like, okay, you have this, now let's resolve it. Or you have this back pain, let's take this. Like we're
Mm-mm.
gonna make sure that we're gonna analyze where you are. And where you are means mentally, physically, and environmental, because all that affects your health. And when we
Yes.
don't have enough time, we cannot address those different issues. And yes, Michelle, interrupt me at any time because I cannot see
Okay. There
what's
is
going on.
okay. Cynthia Townsend asks, are you working out of more than one location as of right now?
Oh, what was that? Working out of
Are
more
you
than one patient?
Yeah, do you have more than one location besides your
Ah,
location in Panama
location.
City?
Um,
Yeah.
no, when I opened my own practice, I I actually was working at another place, but then I came to the realization if I want to really dedicate and give everything to this type of healthcare, I have to let go. And that was a hard decision. Because when you're starting your own business, you're like, is it going to work? It's not going to work. Yes, you trust in God and you have faith that He'll take care of what He intended for you to do. But as humans, we are like, let me have a safety blanket. But when you trust in
Yes.
Him, you're like, you know what? You put me on this path. So this is what I'm going to do. I'm going to go all in. And strangely, that's when the business just blew.
Get
When you
bigger.
let go of everything and
Yeah.
just trust on the process and what you're doing. So no, at this moment, we are we have our location in the city. We had another location recently, up to recently, in a place called Toucan. It was a country club, but that was
Mhm.
inside that wellness center. The wellness center closed because they had some issues. So we are back at our own location, which is a sign that I can now have
Mhm.
more time to move into
So,
located
but
areas.
you do telehealth too, right?
Yes, you telehealth, we do health calls. Yes, I have patients
Okay.
telehealth in the States, Canada, in
Yes.
Europe, I'm in France and Spain also. So we do telehealth worldwide
So
because
if you're looking for some good preventative medicine, someone who can look at some of your stuff before you get to the point where they're doing proactive, you want to be reactive, you want to be proactive. G Lowry 7228 says, yes, Dr. D, it would be amazing to have your office out here. You have another question from Ace's mom. As a woman in menopause stages, how would you go about assisting that journey, seeing that blood work is not very accurate due to sporadic hormones? Do you lean more into HRT, or how would you handle? What is your approach?
great questions. And
Yes.
one of the good things or one of the best things of preventive care is that you get to know yourself, your patients, and your limitations, and you build a team around that. You want to build a team that will supplement what you're lacking or what you need to complement to assist your patients. In saying that, um, you're absolutely correct. If you base yourself only on blood work, on your hormone count, that could give you false information if you do it the traditional way. That's why
Mhm.
preventive, we move what a functional and holistic. We just don't concentrate on the hormones. We concentrate on things like thyroid. What's your vitamin D levels? Things that you normally wouldn't be checking, but that
Mhm.
could affect your metabolism at later stage when you don't have the support of your hormones. So in that regards,
Mhm.
yes, we look at blood work and extensive blood work, but also we look at the symptoms, we look at the environmental, and we work with gynecologists to determine the best course of actions. Hormone replacement therapies, they are good for some people. I don't want to say most
Mhm.
people, but for a vast majority, they work fine. But there are some people that they don't work. There are some people that have some family history or pre-existing condition that
Mhm.
HRTs are dangerous. So you have to have
Mhm.
options. And
Right.
realizing that medicine is individual is the key for
Right.
real healthcare. That
Right.
not
Oh,
all
and I
patients have.
she
Yes.
left. I forgot. She left off a part of her question. She said HRT or natural supplements. I
Oh,
forgot
yes.
to. I forgot to put that part in.
Yes. And I always will lean more on the natural part as the base treatment and complement or supplement with medication when necessary. Because we
Okay.
were amazingly and wonderfully made. We have the ability to heal and to just modify our way of living as we go into different stages in life. We have that ability to adapt and to just prosper. So tap
Mhm.
into that potential makes all the difference. But we are so accustomed of depending on medication, on chemicals to do the work for us that we have lost that ability. We don't believe that
Mhm.
we can modify, and sometimes we need those chemicals for a while And finding that balance between natural and supplemented with medication when needed is the key for real healthcare.
Yeah.
So yes, we do
Um,
a little bit of both.
so Aqua San said, tell Dr. Duncan he will be loved, so loved if he came to Boquete. Miss Celeste is here. She said, hey there, guys. So Miss Ace, Ace's mom wants to know, how much are your telehealth appointments on average?
Yeah, on average, it's a whopping $25. I'm so sorry. Yes.
Wow, a 20. That is, man, that is sometimes less than a copay,
Yes,
right?
exactly.
Okay.
The idea
And
is
do
to make
you
it
have,
affordable. Mhm.
uh-huh. No, I'm sorry, go ahead.
No, I was saying that the idea is to make it affordable so people can access to healthcare. Like that is the whole goal is to realize that you are entitled of real healthcare and what it looks like. So when you see it, you can just take advantage and knowing yourself is real medicine. So yes, you were saying.
Okay, do you another question, do you have GYN on your staff or do you refer out?
Have depending on the case, because even that, depending on the case, we have in our staff, or I have a referral to a specialist, depending on the case. I have a
Depends
couple
on the
GYNs
case.
that I in staff or refer, which there are
Okay.
both of my
So it's
company.
so it depends on your situation whether he
Mhm.
refers you out. Um there's a question Aqua Sands asked, can we pay telehealth from the States for Dr. Duncan? So you do
Yeah,
have client patients in the States. So that is absolutely a yes. You can see
yeah,
him. And if you want your good thorough lab readings, this is where you need to go because you're gonna
absolutely.
learn
Good thing you
everything.
mentioned that. That's part of preventive medicine is teaching, is educational medicine. A lot of the times you do tests, all the time, they're good in the States to, for your regular test. But then you go and doctor says everything was good or this was just high and that was it. Like you
That's
do a
it.
bunch of tests. You have to understand what each test means. And it could be normal. And a value could be normal from 1 to 10. And
Mhm.
11 is abnormal. So 1 is not the same as 9.
Right.
Both of them are normal, but it's not the same. So understanding like where you are, it's more than this is good and this is bad. Is this
That's
is
right.
good right now, and this means this. If it's creeping up, what's going on? What are we doing? Is there, I'm gonna rephrase, not they're not waiting. They are, the system is designed to, if it's normal at 1, 2, 3, 4, 8, 9, it's creeping up, but it's normal. When it goes to 11, ooh, it's abnormal. Start taking
Yes.
medication. What
Yep.
happens between 3 and 9?
That's
How can
true.
we prevent that? And knowing
That
that
is
is
true.
the sweet spot between real healthcare and just plain medicine. And that is the
Wow.
advantage, again, of real healthcare with a preventive approach. But there are some disadvantages. You would say, like, what? Like in my case, I thought there wasn't. But as recently as yesterday, we had a client that was waiting for an hour because medicine is individual, you can I space patients like an hour between, because I know it's going to take some time to do real medicine, especially if they are first
Yes.
timers. So I have a couple and it extended way more than I thought, but it was necessary. There was a lot of issues to discuss. And there was a
Right.
patient that was there on time waiting. That patient didn't had, it wasn't the fault of that patient that we had to extend it and that patient
Right.
had to wait. So that patient was upset and I
Mhm.
received one review in Google, but
Mhm.
it's not on the patient's fault. Like
Right.
that's one of the disadvantages, or I don't know how to say, like shortcomings
Yeah.
of that preventive style. That if you care about your health, that patient was, let's say, could have been in pain, or could have been having an issue, and that patient felt that her time wasn't validated,
Right.
and
Right.
maybe it was our part, like the stuff around, just circling around, like, so sorry, just reassuring, because there's always room to improve. Even the best
Yes.
system has room to improve. If we can improve on, learn from these lessons and improve on those stuff, it's not that we're gonna change the way of doing medicine because of that. If we have to receive more ones, we'll receive those ones, because the time that you're spending in front of me, I'm not gonna cut it short because you are
Hmm.
in an issue. It is, I
Yeah.
have to resolve an issue. But there are
Yeah.
things
I
that we can
understand that.
improve
Hmm.
outside when
Some
you're waiting on the waiting room. So
sometimes, yeah, sometimes things happen like that unexpectedly.
yeah,
You have to stay with a patient longer than you expected. It happens, and so
and yeah,
like you know,
and that's part of
um,
a preventive
it is. It takes
approach
longer.
dedicated to that time.
Hmm.
So yeah.
So Floor C27, Dr. Duncan definitely has to come to Boquete. We have another B. Wallen. If people would eliminate sugar and processed foods from their diets, their health would greatly improve in a short
Oh,
amount of time. In other words, get off the standard American diet. And B. Wallen, I'm just going to say that that is a great thing to say, but you
who said
also
that?
have to be willing.
Be
He's on here. Be
willing,
willing.
on
He said it.
point.
He is, but what I want to say about that is that it's hard to get people to just say do something because you say it, right?
Yeah.
Like we could preach to the choir all the time,
Ooh,
but the cue is or the clue is trying to meet people halfway and go where they are and try to bridge them over. So like, yeah, if everybody would eat healthy, if you live
mhm.
in the States, it's more expensive to eat healthy. That's what it is.
Yeah.
The processed foods and the sugary stuff is the cheapest way to go. And so that's
Hmm.
where most Americans, because we know in the States, the fresh stuff is a lot more expensive. And
Yes.
it's vice versa here in Panama. It's like the healthy stuff is cheaper versus that unhealthy stuff you may pay a little bit more for.
And
So,
sometimes you don't have that option in
right.
your area of, and it is hard. It is hard even for us that know. I eat healthy, I would say half of the time, but we try. It's
We
a process.
try.
Like you say, it's compromising. Um,
It
and
is.
it's true. If we did that, it would be a world of a difference.
It
But
would.
what is the second best option? What do I have to do to be as healthy as possible? Compromising. It's eating healthy, yes. It's doing physical activity, yes. It's the stress level. Over there in the States, that is a huge cause
Yes.
of inflammation as well. You could eat healthy, you can do exercise, but just being stressed causes inflammation. Those type of
Mhm.
inflammation that causes aches and pains that people say that's old age. That old
Or they
age
say
is,
or they say it's in your head, but it's
yes.
not in your head.
Well, it's in your
They
head, and your head is
That's what
causing
they
that
say.
inflammation.
That's
Yes,
what
and
they
it's a
say.
physical thing. It's a physical thing that I'll
It's a
call
physical
a
thing.
hormone called cortisol that causes inflammation and causes mutation of your cells and causes not only inflammation, hopefully it was only inflammation, but heart issue, stomach issue, cancers, and other stuff. So it's a holistic approach. Yes, I'm trying to eat healthy. Yes, I'm doing exercise, but how do I manage my stress is also so very important. And all of that is what we have to discuss. And in 15 minutes, half an hour, it's kind of hard to
Yes, it
address
is.
that when you have had a
Mhm.
lifetime of baggage that you're bringing. But you think that
That's right.
just because you're moving across country, everything is going to be fine. A lot of things are going to
Mm.
get better, but you have to deal with your stuff that you're bringing. And it's a process. And
It
you
is
get
a
desperate
process.
when you get to a place and this is not what I intended. It's a process. It's going to take time, but it's well
Yeah,
worth it. I can assure you.
it is. All right, we have another question in here. Q Lowry asks, do you conduct prostate exams or is that something you refer out?
Yes, it's the urologist. We normally, like I said, we have a team, and then we have the urologist that do the prostate. We do the general examination. We provide a PSA, which is the blood work, and then we give that information to the urologist so he can have a better understanding when he tests and check that prostate, what it's feeling versus the numbers and what we found about the patient. Is the
Awesome.
is the work as a team.
I hope that answered your question. Aqua Sands asks, please give us the link to Dr. Duncan's telehealth link. But do they have to schedule an appointment to receive that link or how
Mhm.
do yeah. So
Yeah,
typically
they
when
call
you
that the
need a
number.
Yeah, typically when you want a telehealth visit that anywhere, you just reach out to the doctor's office and you schedule a regular
Mhm.
appointment or schedule an appointment, and they'll give you, they'll just tell you if you want face to face, telehealth, what kind of appointment you want. Okay. Ms. Parker asked, how many days in Panama will I need to be seen by you to get labs and have you review them with me? So if she comes to Panama, how many days you think would be good for her to stay in order to see you and get the labs back and review them?
Okay, depending if you want to review them in person or via online, because I had patient that came in, we did a consultation, had lab, left the same day, came in like they scheduled it. This guy scheduled with intent. He was in transit, so he was going to be in Panama for 6 hours. So he stopped in the airport, came with bags to the clinic, did the lab work. We sat down a couple hours, then he left. I don't know if he went, did some tourism, ate something, but then he left and we reviewed them like 2 days later. But normally, like to review it in person and see the labs, you could have like 22 hours, like 3 days.
3 days. So
Yes,
about 3 days if you want to see him, do lab and get your lab review.
in
Typically, you can
person.
probably see him in person, get your labs done, and then have him go over the labs with you over the phone if you have to get back. That's also a good
No, actually in
way to
person.
do it.
Like if you want to review it in person, like 3 to 4 days. If you want to
Okay.
review it over the phone, it could be the same day, 1 or 2 days. As long as you
Okay.
schedule it with advance, we can accommodate that.
Okay. Ralph Cordy asks, do you offer IV therapy at your clinic, hydration, vitamin B, energy, and immunity boost?
Yes, great questions. And I'm doing a poor job on promoting the services of the clinic. Is yes, we have that as one of our strong arms from Smart Clinic and Lab. Um, I was looking for a method to detox and to provide vitamins and that with the least amount of chemicals. So I found this company of all the places in the world, Germany, house of Bayer and Merck, like heavy chemical companies. This company Heal that do homeopathic medications based on uh, echinacea, like hibiscus, like plant-based medicine. And at first, as a doctor, you're like, as a scientist, like, does this work? But then when you try it on yourself, you're like, oh, I know what I'm feeling, but it should be subjective. This is my mind just playing tricks. So I do test on my lab, did the therapy, and then test again, and it definitely works. So we have like detox, anti-inflammatory, multivitamin, immune boost, even one that's called balance that helps like with the symptoms and your body to manage like premenopause and things like that. So yes, we
Oh,
do
wow.
IV therapies, hydration, specific vitamins, minerals. Absolutely, absolutely.
Okay,
That
great.
is a
Um, Aqua Sand says, I can agree 100%. Here in the USA, it's the stress that is causing inflammation, etc. problems. People here don't realize this is a big problem. You have lots to you have lots to work, lot of work to do on us, Dr. Duncan. And I can say for myself, um, I came here with a lot of stress and anxiety, and I've been working on I still have it. We talk about it, and a lot of it is like deprogramming your body and your mind to live on that fight or flight level because
mhm.
being in the States, you're always on level 10, like always on
Right.
guard. Something's always going on. And so like your body and me being a nurse, my body just never got to the relaxation phase. It's always been in a fight or flight mode. And
Mhm.
so being here in Panama, I've been trying to rework my system. I need to do more work on it. Um, but it's hard to deprogram yourself
It takes
from
time. It's a
living.
process.
Yeah,
It's gonna take
it
time,
is.
and yes, knowing where you come from and what you are looking for, because a lot of people leave the state because they are very sure of what they don't want, what they're living, but they're just moving to someplace. Like, know where you're moving to, know what you want to get. Yes, you don't want this. What do you want? Define
Right.
your objective. And this stage of life, you want to start living. You've been existing, surviving for a long period of time. Now, be intentional in living. Take care of your health. Like start taking care of your health. It is completely different. It's so different. And on that regard, awareness, education, that is where real healthcare steps in. Because you could, as a doctor, you could spend an hour and a half with a patient just talking about health and all that. But if the patient understand what you're saying, understand the role that they play in their health, it doesn't matter if they remember what you were saying or half of what you were saying. If it makes sense when they're eating certain things at a certain time, it's like, okay, it makes sense. If I eat it at that time, the same food it's not gonna suit well with me. So let me eat it at this time. Or what
Mhm.
changes I have to make when it makes sense. That's when health start it being part of your life. You make decisions based on what is better for your body and for yourself.
Yes, and that is awesome. I love that. Celeste Gardner said, wow, she loves that therapy. She can't wait to try IV therapies, and she will be moving to Panama City, so she probably will be seeing you, her and her husband, when they get there.
I
Um, if they have not seen you already, I don't know if they came to you yet or not because they've been in the city quite a bit. But yeah, I just, back on that preventive thing, that, a lot of the things I do here on this channel is education wise when it comes to healthcare, chronic disease management, things of those that nature. It's not as exciting as, maybe I'm going to the Costa Concentra today and we're going to see the shark jump or something. It's not that
Mhm.
exciting, but it is valuable for us, especially coming from a place where everything was about medicine. Like you feel you got a headache, take a pill for this. You feeling depressed, take a pill for this.
Yeah,
You going through menopause. Oh, you depressed, take this. I mean, so coming from a place where everything is thrown to you like a instant something instant, it's a little bit different way of thinking when you got to be the person driving that car. You have to have that buy-in and wanting to have that healthcare for yourself or that healthy lifestyle. You got to be
yes,
the driver of that. And so I think that's why it's so good when we come to see you, you spend so much time with your patient or the person you're seeing to get to know them so that you can offer them those different types of treatments or a little bit about them.
absolutely. Because again, if medicine was one pill fix all, I won't need that time. But because medicine is individual, you get you need to know what you're going to give, what you're going to treat, how you're going to treat the patient, and it's a lifestyle change. It's not pills involved. Sometimes it is, but most of the time is getting your acts in order and removing some of the pills. Sometimes bunch of pills is causing other issues. So getting to know that patient is key. And on that regards of education, like you were saying, it's not as exciting, but it's absolutely necessary. I can only see patients a certain amount of hours a day. I would
Mhm.
love if I could reach everyone in the world. And on that regards, uh, we're starting a podcast series, the
Mhm.
Dr. D Exchange, coming starting
Okay.
next month, like July.
O- Okay.
And, because I've
Make
been
sure you
trying to
give
get
us
you,
that. Give us
you
that.
should,
Yeah, I'm gonna be on there. Yeah, but
yeah,
make sure
because
you
I've
give
been
me
trying to
that
get
link
you
and
in.
stuff so I can
Yes,
like put that on
in
here.
there.
Um,
'Cause what
Raven
we're
C
doing is,
said, "Good." Yeah,
uh-huh.
go ahead. Go
Yeah,
ahead.
because what we're trying to do is just give that light. And we're going to just be sharing experiences of people like you, Michelle, and
Mhm.
your husband that left everything behind and started anew, and why
Yes.
and how that affected your life, how that affected your
Mhm.
relationship, your health
Mhm.
wise, and just sharing those experiences. The people are maybe thinking like, I would love to that. That's not me. There's no way I could do that. Different perspectives from there's
That's
like
right.
professionals, expat retirees, vets that have started anew. Because you said like I'm 50, I'm 60, I'm 70. I cannot start over. Like what
Mhm.
happens when you have spent your entire life building something, building a legacy, and you're willing to leave everything behind to start anew? How do I do that? And what does that look like in a new place?
What
So
does
we're
it
going to
look
start
like?
those those series of podcasts, sharing those
That sounds
stories
interesting.
and just showing people and
It get
doctors
done.
what does real healthcare looks like.
Look like.
We could put
Okay,
that in the
that's
mind.
awesome. All right, so we have a couple more comments. Ralph Cordy said, "Thank you, Dr. Duncan. You really make us feel comfortable while visiting your clinic. Medical yellow, first red." I don't know if that was was supposed to be a flag or what, but he said that you really make us feel comfortable, and he appreciates you, and I appreciate you because I know when we go together, I take up like most of the time with my issues. He's never complained. He doesn't complain about anything. He's never have any problems.
Yeah,
That's
you know,
how he
having
is.
an issue.
He's so easy going. That's how he is. Um,
Mhm.
Floor C27, how can we get in touch to schedule an appointment? So I will have to I can drop his information in the link here. I'll
Yeah.
get the information. It's just Smart Clinic and Lab, and you actually can find it.
Yes, even though well, there's the WhatsApp for like for the clinic, which is
Yeah,
because it's a Panamanian number, the area code is 507, but
let me
it's
write that in here. 507
6843
6843.
4081.
So in order to reach him in Panama, you have to use your WhatsApp. If you have a WhatsApp app, because you can't dial straight from the US because it has too many digits. So you got to go through WhatsApp.
No,
Is
but
that
on
right?
WhatsApp. Yeah, on WhatsApp
On
you
WhatsApp.
can
Because
yeah, just
on
contact
WhatsApp
us.
you can, but in the States we use a regular telephone and we
Oh,
text
okay.
regularly. So if you're
Yes,
in the
no.
States and you're trying to reach him, you have to go through WhatsApp. That's the main way
Yes.
they reach each
Mhm.
other here in Panama. So you add that 507 and that number, and that's how you can
Yes.
reach him. If you have any further
641.
questions or just reach out to me. Floor C27, Raven C6471. I can attest to the IV therapy. My mom and I both had a treatment, and she said she noticed more energy. I wasn't sure of her results, but she definitely had more stamina, and we will return. So that's one of your returning Raven C. So awesome, awesome, awesome. Floor C, how can we get in touch to schedule an appointment? So you could go through that
Yeah, same number.
smart clinic lab thing, the number that I left on here.
Mhm.
You can reach out to him through that phone number. Okay, Ace's mom, can we talk about free local health care like vaccines? Like if I needed a vaccine for a flight or a country, do they have a free vaccine clinic there in the city or in Panama in general? Or
Well,
are you aware?
they yeah, they are the government clinics, which is they are distributed like everywhere, where you can get the typical vaccine like COVID, flu shot, Hep B, tetanus. Like you have those there. There is, I think, the yellow fever vaccine that's on the regional healthcare center in Panama. That's in Corozal. I think you have to pay for that one. There are certain countries that requires that yellow fever vaccine. You have to pay. I'm really not sure what is the amount, but for the general regular vaccines, they are the health like the government health clinics, which anyone can go in and receive their
Mhm.
shots, and they'll give you the your card and or kit.
Yeah. I think they have something like that here. Me and
In
Ace Mom
Chiriquí,
was
there
talking
yes,
about
in
that.
Chiriquí they should have 3 or 4. They'll distribute
Mhm.
alongside the city. Yes.
Yeah. Aqua San said, "Thank you, Michelle. Thank you, Dr. Duncan. I so love this show." So that was the last comment. We had some great questions in today in the chat, and I just wanted to let Dr. Duncan, if there's anything, I did want to ask you something. Cholesterol.
Mhm.
Um, I had a good example. I had my cholesterol done and it was actually lower. The total cholesterol was like under 200. My husband
Mhm.
had his cholesterol done and his was over 200, slightly over 200. And there was a difference between our cholesterol. actually his wasn't bad based on his genetics, but mine was
Mhm.
bad based on which one I had. Can you explain a little bit about the different cholesterol, just a little bit? I don't want to get too technical, but I know some people see a number as 250 and the doctor say, oh,
Mhm.
that's bad. And then you have another person who has a cholesterol that's 180 and they say, oh, that's good, but they're not looking at the different cholesterols that cause it to be bad or good.
Yes, absolutely. And that's one of the gray areas where doctors can just prescribe based on your level of total cholesterol. So total
Right.
cholesterol is a formula between your good cholesterol. The good cholesterol is that one that will protect against your total cholesterol, bad cholesterol, and triglycerides. Triglycerides being triglycerides is a type of cholesterol that is when the body takes sugar and carbs and store it in the liver as fat, that is triglycerides. And then bad cholesterol is basically like what you're eating or genetics. So it's like there's a relationship between those cholesterols that could give you really what is good or bad. Your total cholesterol, the level is 200. If you have, and this is an example, let's say you have 205 of total cholesterol, that's high. Doctor will want to put you into statins, a cholesterol medication. But
Medicine.
then your triglycerides, the limit is 150, and you have 75. That is good.
Mhm.
The key would be your good cholesterol. Your good cholesterol normally is with between 35 and 75. This one, you want as high as possible. This is the one protecting. So if you have a 70 of good cholesterol and a bad cholesterol a little bit slightly above its limit, at the end of the formulation, you have a risk factor. That risk factor with those numbers I just sent you would be low risk. So you don't need to take medication. But you can have a patient that have 199 or 180 of good cholesterol, has a triglycerides, the limit is 150, has 140, close to the limit, not bad, has a good cholesterol of 35, right threshold. And has a bad
Mhm.
cholesterol, the limit is 100, a bad cholesterol of 98. His risk factor is going to be medium to high because the protection factor is not there. And at any moment, those good numbers can shoot out. So
Mhm.
more than a number, good, bad, you have to see the relationship between the good cholesterol that's protecting you against what is protecting you against your lifestyle, because that is not part of the equation, your physical activity, your diet, when you're eating, what and not, to check and see your real risk factor. Because just
Mhm.
numbers are not going to cut it. You have also
Right.
what is their calcium score, that is a test that you check and see your arteries and see the buildup of cholesterol.
See?
That
Yeah.
you could have a good cholesterol, but you have a buildup that is going on there. So it's a lot of
Mhm.
factors there that goes into that, not just the
And I
numbers.
wanted to the reason I brought that up is because there are a lot of us from the US that are taking medications that the doctor recommends for us, which we trust or we listen to the doctors. I don't know if we trust them per se, but we're taking a lot of medications unnecessarily. Just because your cholesterol is over 200, that doesn't mean you need to be on a statin. It just means that someone needs to analyze your numbers and see what is really going on with you. Do you really need to be on that medication? Is it genetic? Can you control it with your diet? Because they don't tell you a lot of times that some of this can't be controlled with diet. Some of it is just passed down to you genetically, and that, you may live with a higher cholesterol. Just like some people live with a higher blood pressure than others, that doesn't mean they're going to have a stroke, right? They ride higher, a little bit higher than the normal 120 over 80, right? So
Absolutely,
I wanted to
absolutely.
bring that up. Hmm.
And again, that attests to the individuality of health.
Yes.
And that sometimes what if we go to the motion of the system, we could be harming more than doing good because those medications, albeit they are good and prevent your cholesterol going up, can also cause devastating effect on your liver. There are some
Hmm.
people that could cause muscle destruction and other complications. While you are trying to prevent something that wasn't an issue, you are causing more harm. So it's always trying to use natural and lifestyle as the base and see if
Mhm.
then after that, if you need the additional, then we see how we can complement that. Because what you're eating, fiber, drinking water, doing exercises, things like that could be cleaning your liver, cleaning your arteries, and helping you way more than just taking a statin that will give you good numbers, but what's going on inside is a completely different story.
Mm-hmm. Miss Parker 770G said, Dr. Duncan, you came to her rescue while she was visiting in Panama. So she
Oh
must have
yeah.
saw you for something in
Yeah.
Panama. Yeah. So we did talk about if you're ever in Panama and there is a reason that you need to see a doctor, Dr. Duncan is available for you. If you could get on, call him, reach out to him. Pretty much he'll get you up in there, you know.
Yeah. And the idea is
So
building a team of good doctors with the same belief, the same healthcare principles of prevention health and patient care oriented. So to reach the amount of people that are in need is, even though I could be have all the intention, one person, and I would love to be at every time at all places at once, having that
yeah,
team of doctors and that way of doing medicine. That's what we're building in Smart Clinical Lab. So me
we
soon,
love
looking for
it. We
that
love
next
it. Look,
part of the
we're trying to
team.
get you all the way up here.
Yeah.
I just wanted to say if you haven't come to the live and you're following, you're watching it on the replay. If you have questions or concerns, you can drop them in the chat. I do check the chat frequently, so I will respond if there's a question that you have related to any kind of medical, health related stuff, chronic disease management, any of those questions that you have, prescriptions, what is available over the
Mhm.
counter versus what kind of what you need to have a prescription for. I would say just basically, if you look at it like this, most things are over the counter except things that will alter your mind in some kind of way. So, like
Mhm.
if you need pain medicine or mental health medicine, anything that will alter your mentation, then you might have to have a prescription for it, just kind of generically. Um, Raven C, I would love to find a chef or meal delivery place that specializes in healthy meals. Does that exist in Panama? It absolutely does.
Yes.
Um, I have heard of several chefs that will cook for you. I don't have the exact number, but there is a group on Facebook, or they're they have reach out to me, Raven C, and I could get you in contact where the people who can refer someone to you. I'm talking about Panama City. I'm not really sure about Boquete. If you're living in Boquete, I'm sure because we have so many healthy places. There is someone here in this area. I just don't know who they are, but I have an idea where you can find it in Panama City. Okay, so reach out to me and I'll send that to you. Aqua Sands 1988. Can you get insurance if you have stage 3 chronic kidney disease? Probably be kind of hard, but I don't know if it's impossible.
No, thanks. Because I was talking to a broker the other time. They said that
Okay, I
depending
forgot.
on where you are, it would be you can get the insurance, but that would be like either they will jump up the or whatever you have to pay, or for that related to all related kidney diseases, it will be covered, or it's a combination, or there are different plans to get
Levels. She
insurance and
said
cover.
she doesn't have any dialysis and her
Mhm.
high blood pressure is under control. So she just
Okay.
at stage 3, she's not kidney failure, so she doesn't need the dialysis yet. But is that when you have chronic kidney disease stage 3, does primary care providers manage that, or they have to be to a kidney specialist to manage that at that level?
No, that like since you have stage one, you want a supervision of a nephrologist, which is the
Okay,
kidney specialist, at least once a
right.
year. Stage three, even more, 2 or 3 times a year, just checking, and your primary working with the nephrologist. Again, as a team, we have a nephrologist, which we referred, very good doctor. So it's working as a team depending on the issue. But yes, you want to have a nephrologist on board to managing that specifically.
So most of the time, Aqua Sands asked a question: can you get insurance with chronic kidney disease? A lot of times when you apply, because we went through we got insurance with Santa Fe when we were living in Panama City, and we had to do an exam, and they exclude pre-existing conditions. So, like if you have a diagnosis of chronic kidney disease already, then a lot of times they will exclude that condition on your insurance unless there's a plan that will include it. I'm not sure about that one. I just know when we had to get insurance, they excluded anything that I had in the past.
And that is case by case. That depending on a broker, the type of insurance, you sit down, they do an evaluation, and they say like this is what you can get. This is limitation. It's very individual between different insurances and your cases. If it's just kidney degree stage 3, then it would be, I think it would be the exclusion, everything that's kidney related, they would put it out and they'll insure you for everything else, or they will put the price, or like that depends on the insurance.
I have Raven C said she has a family member who needs dialysis but is afraid to travel due to the cost. Are there reasonable costs or insurance to cover for that service or treatment? I just did a little video about dialysis in Panama. As far as traveling, I don't know, but I know that they do have dialysis treatment centers here and in Panama City. David, Panama City. There's a major hospital actually in Panama City that was I forgot the big hospital that's affiliated with is it Punta Pacifica?
With the John Hopkins?
Yeah.
The Pacifica Salud.
Yeah. So
yeah, the Pacifica Salud, the Panama Clinic, San Fernando. Yes, absolutely.
And I was looking.
And the public.
And so they have the private and the public system.
Yeah.
I was trying to do a little research on the cost to have dialysis if you paying out of pocket, but I hadn't got that far in it.
I'll check on that.
I know that dialysis treatment is a little bit expensive anyway, no matter where you are. But here in Panama, it's probably more reasonable, if you could say that. So we'll look into that and see about the cost and see if it's even or insurance to cover that, because I'm not aware of any insurance that covers that, but I could have just not done enough research on that. So that is something we will look into. All right. Well, we appreciate everybody for all of the questions and coming on to the live and all of the back and forth we got. We probably will do this again maybe in the future, but I think the next goal is for me is to do Dr. Duncan's podcast. So he did put a little advertisement out, but you want to kind of do your advertisement again so people can tune into your podcast. And what is your podcast going to be about?
Yeah, it's going to be about, the Dr. D Exchange is going to be about how to reinvent yourself at any stage of your life, how that would affect your relationship, your health, how and why do people do that? Like your story, would like to see your story.
Yeah.
How you were a nurse, and all of a sudden you decided like this is not what I want, and decided to leave everything and start anew. So sharing those stories. Sometimes we'll have like expats, sometimes we'll have just professionals sharing what does it look like here in Panama about health. It's about stories, it's about experiences. So I started anew, and that would be again starting next month. I think around the second week of July, and I'll have the information. I'll send you the information. So you can put it out there.
I will be putting that information out for you guys. And I haven't really shared, or maybe I have in my earlier videos about how I left the US, what sparked my wanting to leave, why I chose Panama, why I left, because I actually retired. I like voluntarily retired, right? I had like 8 more years before I can actually get into full retirement. But my whole thing was like, when things started changing with the VA, when we got our new president, a lot of things started changing and people were getting laid off. So I'll tell my whole story. I'm not going to do it on the live, but it's pretty interesting. So Ace Mom wanted to say thank you for an amazing live today. Q Laurie said, what a live, good information on here. Thanks, Dr. D. Dr. Aqua Sands, Dr. Duncan, please come to Boquete. TDE, let's go, TDE. That's Ace's mom. And Ralph Cordy said, thank you both. Great job. So I just want to thank you again for coming on here and sharing your wealth of knowledge and education, healthcare, lifestyle, all that stuff is important. And we just want to thank you for being on here. Thank you for sharing your information. And thank you for being the type of doctor that we need. Like, we're so used to doctors just throwing stuff, just take this. Nobody really taking the time to get to know you as an individual and see why you might have these problems. So we want to thank you for that.
No, and thank you very much for this opportunity to share the knowledge and this information, and to open the conversation of what does healthcare really looks like. Because most people believe that healthcare is what they've been accustomed to receiving. This is that. Like, I guess healthcare is a couple pills and live with the symptoms and just take care of the symptoms. Like, really, this conversation is open of like what does quality of life looks like, what does quality of healthcare look like, and opportunity to promote the services and to be out there. And for all of you guys listening and showing support, whoever has been at the clinic or had a consultation, the good reviews on Google are also welcome. So put them out there. That would be appreciated. Again,
it's crazy how we, like, you'll have the most best experience and you won't say a word. But the first time you get something bad happen, you be the first one that be on there.
Yeah, and I do the same. In a restaurant, I love the restaurant. All of a sudden, like, oh, it was good. You know what? Like, but it's okay. It's okay. It opens for the conversation.
Guys,
and there's
send
always
Dr.
room
Duncan
to
some
improve.
good reviews. If you've seen him and you enjoyed your care, he spent time with you and provided all good care and good service. Go ahead and give him a shout out on Google, right? A Google review. Is that what we're talking about?
Yes.
Yeah. To keep his business, and we want him to stay good because we try to get him out here where we are. Okay. So thank you again. Thank you everybody who came. If you're catching it on the replay, hey, welcome. Drop your questions in. We got something for you too. So you guys have a great rest of your day. Thank you so much for tuning in, and I'll see you guys on the next one. Bye.
Thank you. Thank you.
Bye.